Hyperbaric oxygen and oncology have suddenly, are also now very, very closely linked. And I think if I take the largest patients we have is non-healing wounds, and then we have a lot of uh, patients who have interfaced with oncology who are being referred to our department. And this will tell you the growth of hyperbaric oxygen with oncology. In the 80s, oncosurgery wounds and post-radiation side effects were the main patients being treated. In the 90s, some of hyperbaric was being used as radiosensitizers and prophylactically in some of the head and neck radiation patients. And in the 20th century, which is phase 3 now, we are finding that hyperbaric is finding a role in the metabolic management and being attributed to the direct toxicity of hyperbaric treatment. Wounds in cancer patients are complex, wide dissections, existing comorbidities, prior exposure to radiation, treatment with chemotherapeutic reagents, and poor nutritional status. Hyperbaric oxygen as an adjuvant in these complex wounds is extremely well established. It improves healing rates in these oncology patients. Again, there is a large number of patients, but I'm just going to just show you some pictures. This is a 58-year-old Ayurvedic doctor, CA prostate, spine metastasis, treated with 35 cycles of radiation and had a radiation ulcer in the spine. A full skin grafting was done, combined with hyperbaric oxygen for almost 40 days, because this was a radiation radiated tissue in an immune compromised individual. It recovered completely. Oral cancers with post-surgical wound delayed healing are again, almost, I think at any given time, we'll have one odd patient with either a surgical wound or an oral cancer. Radiation tissue damage, again, hyperbaric is the only treatment. We know that radiation therapy causes the 3H tissue response. It makes it hypocellular, hypovascular, and hypoxic. And this results in fibrosis and vascular inclusion. These get worse with time. So you'll have patients referred 5 years after radiation treatment, even 8 years after radiation treatment. And chronic complications of radiation may not get better with time, and they are likely to get worse. Hyperbaric oxygen is extremely well established in radiation, and we can actually have an entire session on oncology and hyperbaric oxygen. So it typically takes about 40 days of treatment. The first 10 is what's called the lag phase, the rapid rise phase, and then the plateau phase. And by combining hyperbaric, you can make these tissues almost as close to normal tissues as is possible. Repeat measurements made between 1 and 4 years after exposure have shown that the TCO2 values have continued to remain elevated. So this is a permanent solution. It's not a temporary recovery from an illness. Osteoradionecrosis of the jaw, again, extremely common. And we've had patients referred from across the world, actually, Middle East, Africa, with post-radiation radionecrosis who have been treated successfully between the dental surgeons, the plastic surgeons, and the hyperbaric physicians. Again, 60-year-old male post-surgical excision of cancer of the floor of mouth followed by radiation. The bone in the facial area, the maxilla and the mandible, are extremely vulnerable, and they have a very limited vascular supply and are easily affected with radiation. And hyperbaric oxygen has a very critical role to play here. Radiotherapy-related sequelae, which are responsive to hyperbaric, and there are enough evidence. Radionecrosis of brain, retina, mandible, proctitis, cystitis, fistula, soft tissue radionecrosis, and radionecrosis of the larynx. All of these are very, very responsive to hyperbaric oxygen. In addition, hyperbaric oxygen is also being used prophylactically for dental procedures, for brain surgeries, and for surgery in tissues which have already received radiation. Hyperbaric oxygen as a radiation sensitizer and prophylaxis is now well established. A slight increase in partial pressure of oxygen leads to a dramatic elevation in radiosensitivity. This is a study of 1994 and not so popular in other parts of the world, but in Japan, they definitely use hyperbaric oxygen as a radiation sensitizer and now even as a chemosensitizer. The expenses for hyperbaric oxygen, when you do a cost-effect analysis, this was a study done in the US. 60,000 patients received radiation. 1 to 5% will develop, will develop complications. 50 60% of these patients who undergo surgery will develop post-operative complications. And hyperbaric oxygen has been demonstrated to reduce the dollar cost and the human radiation complications of hyperbaric oxygen. The 20th century has been extremely interesting, and I think what is really important, I will go to the next slide first, because there seems to be a very, very close interaction between hypoxia and tumor progression. And this has been demonstrated repeatedly, and more so recently. If you look at the 2019 Nobel Prize in Physiology and Medicine, what did this prove? This was the third Nobel Prize in the field of oxygen. And even after 200 years, we still need to learn more about oxygen. But the 2019 Physiology and Medicine Nobel Prize, what it demonstrated was that how do cells sense and adapt to oxygen toxicity? And why does this research matter? But this research helps us to understand how oxygen levels can affect cell reactions. Drugs that can activate or block these oxygen sensing mechanisms may be of use in treating cancer and other diseases. This has led to a whole flurry of activities. And if you look at publications in the last 5 years, every leading journal in the world will have at least one study on hyperbaric oxygen and its use in radiation-induced plexopathy, as an adjuvant in osteosarcoma, in metabolically supported chemotherapy and ketogenic diet. So hyperbaric oxygen and oncology seems to have now found a very, very close link, especially with the Nobel Prize finding, where they have demonstrated that hypoxia is responsible for tumor growth. So if you can reverse hypoxia, you can actually slow down the progression of cancers. Other indications, there's a whole lot of them. I'm just going to mention them. Acute sensorineural hearing loss